Okay, good afternoon. Again, my name is John Farnsley. I'm with 90 Degree Benefits. Welcome to our quarterly webinar Wednesday. Thank you guys for joining us today. We'll try to move quickly and get everybody out of here in 30 minutes. Um, I have been in this business now for, about 30 years. And it struck me the other day as I was kind of thinking about it. For all the years that I have been in the healthcare world, the consumers of our industry have really been asking for the same thing. If you think about it, we have been asked for exactly the same thing for the past 20, 30, 40 years. The consumers, the health plans, the people that are buying health insurance, they've asked for that elusive healthcare holy grail, the holy trinity of healthcare, however you want to define it. They're asking for a health plan that's based on cost, quality, and access. It's really not complicated, it's just hard. But all the customers that we work with tend to ask for the same thing. We want a health plan that's affordable. We want a health plan that's got access to a broad PPO panel, lots of providers in. And we want a high quality health plan, not, and by quality, not just provider quality, but quality in the benefits you can actually use. And I would argue that if you're a school teacher making $45,000 a year and you've got a health plan with an $8,000 deductible, it's going to be tough to use that health plan. So we've been asking for 30 years for this health plan, this healthcare holy grail of cost, quality, and access. And the industry has answered exactly the same way for the last 30 years, which is, pick two out of three, right? That's what we get. The industry basically tells us, hey, I can get you a health plan you can afford. I can get you a low cost health plan, but it's going to be an HMO or it's going to be a narrow network or it's going to be a reference based plans. It's not going to be the broad national PPO plans. Or I can get you the broad national PPOs, but boy, it's going to be expensive, right? Or I can get you good cost on a broad network, but the benefits are really bad. It's going to be hard to use the plan. So we've answered the question as pick two out of three, whichever ones you want, that's what you can get. Meanwhile, we've all just kind of fumbled around going, yeah, but somewhere out there, there's got to be this healthcare holy grail, this affordable health plan with broad access and quality benefits. It's got to be out there. And so what do? We do what everybody does. We go to the professionals. We go out and we find maybe a TPA or we find a consultant or we find some healthcare professional and tell them, hey, here's what I'm looking for. I'm not even sure exactly what it looks like, where it is. How can I find this healthcare holy grail? And most of those conversations look something like this.
I have no idea what it looks like. Which one is it?
Let me choose.
Thank you, Doctor. More beautiful than I ever imagined. This certainly is the cup of the King of Kings. Eternal life. What is happening to me?
You chose poorly.
So some of you in the benefits world can really relate to that video. You have this healthcare expert that shows you this shiny new plan, and you realize really quickly, ooh, I chose poorly. And it feels like that quick, horrible death, doesn't it? Because you can't get out of the plan for another year. So we think it's out there. We're trying to find it. What's it look like? How do we get that healthcare holy grail? Well, to start the quest, we've got to figure out maybe where we're at today. We've got to figure out where the market sits today, because certainly we haven't found this yet. And I think it's kind of interesting because we'll do these talks around the country. And one of the questions I like to ask people is, tell me what you see as the issues in health insurance today. Tell me what they are. And you'll get a lot of responses from the crowd, but almost inevitably, you can take all of those responses and they fit pretty neatly into two buckets because there's a reality to health insurance today that looks a little bit like this. It's too complicated and it's too expensive. And if you think all those things that were running through your head when I said, what's wrong with health insurance? They probably fit in one of those two buckets. We ask people to navigate a really incredibly complicated healthcare maze. A lot of us are in the business and it's complicated for us. If you're the guy out there working for Bob's hardware store that doesn't know nothing about healthcare, it's hard. The expense side we see every day, but I almost think because we see it so often, we lose perspective on just how expensive it is and what it really means. You guys may have some more up to date data. The latest figures that I saw from Kaiser were from 2000 and the 23 plan year. The average premium for a family is around $24,000 a year. Now, obviously, it goes up every year. By the way, I saw a report this morning from Benefits Pro that said 2025 premiums were expected to be up 8% over 2024 premium. So 25, we can expect premiums of probably $2,400 for a family. And that's huge numbers. Now, I know I'll get the comment sometimes, yeah, but the employer pays for some of that. True. But every dime the employer pays on benefits is a dime they don't have available for salary. So ultimately, it all comes directly from the employee. So $24,000 a year, $2,000 a month. For perspective, we could go out today in the worst real estate market in the history of mankind, and we could buy a $300,000 home with a down payment at 7.1% interest, and our payment with mortgage, taxes, and insurance is going to be less than our insurance payment. So just think about that for a second, let it sink in. For most families sitting here today, the cost of our health insurance today in 2024 is more expensive than our car, it's more expensive than college, it's more expensive than our house. It's the biggest investment we currently make. And that's astonishing when you think about it because that was not always the case. So when those numbers get that big, I think it's reasonable to say, okay, A, how the heck did we get here and what's driving this cost? Um, we can explain how we got here, but that's a different presentation for a different day. But health insurance is not as complicated as we're told. And certainly we're going into this election year where we will be told, oh my gosh, health insurance so complicated you can never understand it. That's probably why we need a single payer system. It's really hard. You can never figure it out. Well, in my humble opinion, health insurance and healthcare is hard, but it's not overly complicated. You see, health insurance is simply a funding mechanism for healthcare. So the only way to lower the cost of health insurance is lower the cost of healthcare. There is no way, it is impossible to lower the cost of health insurance if you do not lower the cost of healthcare. So the question that we really need to ask ourselves is, okay, if that's the case, how do you lower the cost of healthcare? How do you lower the cost of healthcare? Well, again, it's not easy, but it's not overly complicated. You see, healthcare works just like any other good or service that we purchase. We just don't like to think about it that way because it's more personal than that. But really, healthcare is just like anything else. It is unit cost times consumption. That's it. Think about the things you buy in your life. Everybody on this call, you're going to have a gas bill for your car. That gas bill is going to be based on two things and two things only. What's the price of a gallon of gas? How many miles are you driving in your car? There's your gas bill. You're going to have an electricity bill at your house. What's the cost of a kilowatt hour of electricity and how long did you leave the lights on? There's your electricity bill. You got a food bill. Did you buy hot dogs or did you buy steaks? Did you buy one or did you buy three? There's your food bill. Healthcare works the same way. What's it cost me every time I walk into the physician office or the hospital or the pharmacy? And how often do I go in? There's your cost of healthcare. It's unit cost times volume or consumption. And the unit cost in healthcare really is driven by just two agreements, your PPO contracts for facility and physicians and your PBM contracts for pharmacy. Utilization, volume, consumption, however you want to phrase it, that's really driven by a lot of things. Benefit designs certainly play a huge role. We know that the $8,000 high deductible benefit plan is not going to have as much utilization as the $500, right? We see that. Compliance with healthcare. Do you get all the preventative services? Are you in disease management programs, wellness programs? You're trying to stay healthy. Those have a direct correlation on the consumption. But however we tackle it, if we're going to lower the cost of healthcare, we've got to solve this equation, unit cost times consumption. So that's the challenge that we've got to lowering the cost of healthcare, which then lowers the cost of health insurance. So really, the question that we have today, how do you lower the cost of your healthcare spend without lowering benefits, restricting access? How do you keep all three of those buckets, cost, quality, and access together? How do you find that healthcare holy grail? And today we're going to talk about really quickly three design strategies that will lead you to the healthcare holy grail. And there are three design strategies that weren't here just a few years ago. They've come about because of changes in technology, changes in legislation, just changes within the industry. 3 or 4 years ago, you couldn't do these. Today, you can. And if you'll follow these three simple steps, it's not hard, it's not complicated. You can put together a plan that wins in cost, quality, and access. And the first design strategy, the first step is this: use care navigation to create a virtual narrow network. I spent the first several years of my career in the PPO world. And what I discovered then, and it's just as true today, is all contracts are not created equal. In a market in network, if you're using Aetna or you're using Cigna or you're using United, in a market, those contracts vary and they vary wildly. What we've done over the past 10, 12, 15 years to lower that unit cost is we've used RBP plans, we've used narrow networks, we've used HMOs, we've used these different narrow facility contracts to lower the unit cost to get to a unit cost that works. But the reality is, you can find them today, but we couldn't find them 2 years ago, 3 years ago. The transparency law that came into place allowed and forced carriers and facilities to put reimbursements online available by procedure. And yeah, I know there were some folks that had some different tools you could use, estimators, but it was hard and it was cumbersome. It wasn't very accurate. And I know when the MRFs and the other things started coming out with the transparency law, they weren't great. But guess what? They've gotten better and they've gotten better and they've gotten better. And today, if you have a program like 90 Degree Care Connect, which is a mechanism to help steer people, you can access RBP level rates without having to go through all the challenges with an RBP plan. I live in Texas, and so we just went in Texas and looked at our market, and we went and looked at Austin, Dallas, San Antonio, Lubbock, Houston, and we look at cost for services. This is from this year, and this is with one of the large carrier networks that you can lease, the Cignas, the Aetnas, the Uniteds. Here's what we found. You can go into Austin, Texas, looking for a total need. You can go to St. David's and pay 112%, or you can go across the street to Seton, which are the two major systems, and pay 452% of Medicare. Or you can go down the road and pay 1,200% of Medicare. There's a wild discrepancy between the cost of in-network procedures in the same market. Look over at Houston. You can go to St. Luke's for 116, or you can go to Methodist for 400, or you can go to HCA for 600. And this happens over and over again. The good news is, in almost every market, 112, 162, 107, those are below RBP reimbursements. Those are way below narrow network reimbursements, and they're out there. They're available and they're in network. We just need to steer people towards those facilities. Do the same thing with rotator cuff. Again, Austin, I can get it for 100% of Medicare, or I can pay 1,000% of Medicare. I can go to Houston and pay 124 or 829. San Antonio 117 or 645. You guys get it. You can see the numbers. Look, market by market, there are reimbursements at quality facilities in almost every market that are below RBP if we'll just take advantage of them. We went and looked at some of the more expensive things, like a low back surgery. Anytime you get into back surgery, it gets really expensive, and that's what the stop loss carriers are afraid of. Well, okay, I can't get 100%, but in Austin, I can get 200%. St. David's, or I can go and pay 6,545% if I just accidentally show up at the wrong place. St. David's 200, Ascension's 1,500. Houston, I can pay 225% or I can pay 1,800%. It goes on and on and on. So the beauty of this is all those reimbursements are out there today. And if you plug in a concierge to steer your members to these reimbursements, you get all the benefits of an RBP plan with the access of a PPO plan. And I'll give you an example of how we're doing this in Texas where it works great. The most common PPO plan that we see is an 80/60 plan. Pays 80% in, 60% out. Pretty plain Jane vanilla PPO plan, right? Well, we'll tell people we're not changing anything. You've got an 80/60 plan. But if you'll go through Care Connect, we will connect you with a low cost, high quality facility. We do a quality check before we send anybody anywhere. So it's not just about price, it's about quality. And if you want to go to, in this example, St. David's for your back surgery, as opposed to Ascension, where it's 1,500%, instead of paying the plan at 80%, we'll pay it at 95%. So you as the member can pay almost nothing for your surgery. The plan goes from reimbursing 1,500% of Medicare at Ascension to 200% at St. David's. The plan wins. The member wins. The hospital that's providing a good service at a fair price wins. It is exactly what healthcare consumerism should look like. And with the transparency law, it's available today. You don't take anything away. You can use your PPO network. We're just going to give you an option to pay almost nothing for your surgery at a high quality, fairly priced facility. Doesn't that seem like a way better option than a narrow network only or an RBP only or an HMO only or an ACO or, fill in the blank? Doesn't that seem like a better option? And think about what that means. Today, for most plans, your hospital spends 35% of your spend. You can plug in this care navigation program and lower your spend by 15, 20%. There are things that it won't move, right? If you're in Texas and you have cancer and you want to go to MD Anderson, that benefit design incentive is probably not going to change it. But knees, backs, all of those kind of things, it'll change those. So we haven't taken anything away. We've just added a benefit. We've added a benefit for members and lowered cost at the same time. Where else do you have an opportunity to add a benefit that reimburses 95% and at the same time lowers your cost? It's there today and it's available. So the first strategy that we recommend, plug in a care navigation program, steer in network, add to the benefits, save money. It works for the member, it works for the plan, it works for the facility, and you can plug it in today. So that's design strategy number one. Design strategy number two, use a PBM oversight program. Today, in the pharmacy world, it is the most inflationary piece of healthcare today. There's no doubt about it. If you go back 10, 12 years ago, your pharmacy spend was 10% of your spend, 12% of your spend. Today, it's 25%, it's 30. We have groups with 50, 55, 60% of their spend is on the pharmacy side of the equation. It's the most inflationary piece of healthcare. Most people believe that your pharmacy spend is going to be higher than your hospital spend in just a few years. Today, our challenges are huge. You're getting double-digit increases in brand drugs. Your specialty drugs account for half the overall pharmacy spend in 2023. They'll be the same thing in 24. ACA removed plan limits. And when that occurred, all of a sudden, the hospitals and pharmacies were highly incentivized to create drugs that were really expensive. So I want you to think about this. Back in around 2010, we had a Hep C drug that came out. Some of you that have been around remember it. The Hep C drugs came out. They were $80,000 a year. And there was this huge outrage thinking, oh my gosh, how are we going to pay $80,000 a year for a pharmacy cost? Well, Fast forward a little bit. Today, 2024, here's your 10 most expensive drugs. I laughed when I saw that because somewhere, as soon as those caps were lifted with the ACA, there was a pharmacist, probably somewhere in the South, that he did hey, hold my beer, guys, watch this, because that $80,000 a year cost, yeah. Zolgensma just a few years ago was the most expensive drug at 2.1 million. It's now not even half of the most expensive drug. Pharmacy costs are killing plans today. If you're simply plugging in a PBM, you're in trouble. You've got to have a PBM optimization, a PBM oversight program. Right Turn RX is designed to significantly lower the cost of your pharmacy without really taking things away from the program. It's built on four basic pillars of success. Number one within that is the power of leverage. We leverage our position as one of the largest TPAs in the country that's owned by one of the most successful Blue Cross plans in the country to work with an independent third party consultant and negotiate contracts that are best in class, both in terms of pricing and plan language. So we have the best contracts available for our clients. We then layer in a clinical oversight program, and these are not the clinical programs that are built into the PBM. It is oversight for the PBM. It's separating prior authorization out from the PBM, getting the fox away from the henhouse. It is looking at the things like step therapy, all of the appropriate clinical programs, both in the PBM and the medical setting inside of care for oncology drugs. How do you provide the clinical oversight to make sure you're following best practices? We have a program that does that's embedded into the Right Turn RX program. And then third, alternative funding programs. We plug in every potential alternative pathway, whether that be patient assistance programs, whether that be international programs, 340B programs, copay assistance programs, site of care programs. All of those alternative pathways are built into the oversight program to make sure we are lowering the cost of specialty drugs as much as can possibly be done. And then fourth, and maybe most importantly, is accountability. We do a retrospective review at the end of the year with the PBMs that are within this program to make sure, okay, we did this contract and we had it analyzed by the stop loss markets and they gave great credit for this. Did you hit the numbers that everybody anticipated you would hit? And if not, why not? We need dollars back. Most people, I see very, very few people out in the marketplace to do today that do that retrospective review, right? We all go out, we quote this group at the start, we talk about these great savings that are come, and then when they don't, nothing really happens. It's critically important that you have this oversight program and that you have accountability. So plug in a pharmacy oversight program at 90 Degree Benefits. It's Right Turn RX. It's done in-house with in-house consultants, and it has all four of these pieces built into it. It's PBM agnostic. It's not about just the PBM. It's taking a PBM and using these four programs to get the lowest net cost for your pharmacy. And here's the beauty of it. Today, 25% of your spend is on the pharmacy. That'll be 30 in the next couple of years. You can lower that cost by 30% if you use a pharmacy oversight program and you've taken nothing away. You're actually getting people high cost drugs at either no cost or very low cost. So you're lowering the cost while increasing access. So think about that. Where can you take such a significant portion of your spend and lower it by 30% without taking anything away from your membership? So, design strategy number one is plugging in network steerage. Design strategy number two is plugging in a pharmacy oversight program to help lower the cost of your pharmacy spend. It'll make a significant decrease in your pharmacy spend. Design strategy number three, use virtual care program to lower the cost of primary care. One of the, I guess if there's a such thing as a good outcome of COVID is what's taken place in virtual care. It's changed significantly since COVID took place. And as I said when we started, remember, it's funny. We think about all the things that we want as consumers that, most of the time, if consumers demand something, it gets delivered, right? We've been asking for this healthcare holy grail forever and it hasn't been delivered. But most of the time, the free market finds a way to get what people want. I think for me, the one that we can't find, The Jetsons had those flying cars that we never did get. But here's what's interesting. In 1968, even though we didn't get the flying cars from Jetson, we did get something.
I tell you, I'm sick. Oh, this is it. It's glowing black. Quick, where's a pencil? I gotta make up my will.
All right, hold on. Just hold on. I'll call the doctor. Calling Dr. Racy. Dr. Ken Racy.
Yes, Mrs. Jetson. Somebody got a pain in the tummy tum-tum.
It's Elroy, Doctor. I think it's the Venus virus this time.
Venus virus. Oh, that can be catching. All righty, Elroy. This is your dedicated physician speaking. Stick out your tongue. Uh-huh. Oh, my.
Well, what do you see, Doctor?
2 dozen gumdrops, a pastrami sandwich, half a pizza.
Elroy. For breakfast?
Well, you see, I thought it was my last day on Earth.
Yes. Well, it pains me to tell you, but there's only one known cure.
What's that?
A full day at school. You're fine.
Oh, fooey.
Elroy. Thank you, Dr. Racy. Sorry to call you needlessly.
Think nothing of it, madam. It's my duty as the nation's #1 dedicated physician.
So, by the way, it's hard finding a Jetsons clip. That took a little bit of work. But back in 1968, Jetsons nailed it for 2024 because there's virtual care plans today that you can utilize that provide virtual urgent care, virtual primary care, virtual mental health. You can get urgent care visits from your house in 15 minutes. You can't drive to an urgent care center that fast. You can get primary care online where you can go select your provider and stay with the same provider. It's not the old Uber or Teladoc model. You can pick the provider you want. And none of this replaces your PPO network. It's in addition to. So people can do these things from the convenience of their living room and they can do it at no cost. And it works for the plan because what we've seen post-COVID is utilization of these kind of programs have went way, way up. In the old days with Teladoc, we were trying to get what, 3%, 4%, 5%. Today, there are virtual care programs that have utilization 40, 50% that save the plan members and it saves the plan dollars. And it does it completely as a completely optional service from the comfort of your home. 22% of the average plan spend is on physician spend. If you can just lower it by 10%, and that's not a huge number, but you can lower it by 10% by adding a benefit. And that's the thing, right? We're adding benefits and lowering cost at the same time. So if you take those 3 simple strategies and you just add them together and go, okay, we're going to use care navigation. We're going to take 35% of our spend and we're going to reduce it by 15%. We're going to use a pharmacy oversight program. We're going to take a huge chunk of our spend and we're going to reduce it by 30%. We're going to plug in virtual care programs and lower our cost by 10%. We're going to lower cost, lower cost, lower cost, and the whole time we're increasing benefits. We're increasing member satisfaction. We're increasing efficiency. Wouldn't you rather take this plan to your employees or your clients where we're not trying to navigate an RBP plan or we're not trying to navigate an HMO? It's broad access. You can choose to go anywhere you want to go. We've just put incentives in to do the right thing and lower your costs. And by the way, as a member, you get rewarded when you do so. So the question then becomes, okay, is this the healthcare holy grail?
There's only one way to find out.
You have chosen wisely.
Choose wisely, whatever you're going to do with your plan. We're still searching for that combination of cost, quality, and access, right? This is what our membership has been asking for 40 years. We believe strongly this is a good recipe to bring that to your clients. And it's not complicated. It's not based on any kind of weird, quirky thing. It's basic common sense. We reduce the unit cost by using in-network care navigation and PBM oversight. We increase quality because there's a concierge that's actually looking at quality on behalf of the members and making sure we're sending them to high-quality facilities. And it's all done with broad PPO networks. So you're not asking members to use RBP or narrows or HMOs or ACOs or any of those. Everything's on incentive base. We don't take anything away from the member. We just add to it. All we're doing is looking at that healthcare dollar and saying, okay, 35% of your spend, here's how we can reduce it. RX is 25% of the spend, here's how we can reduce it. Physician is 22% of your spend, here's how we can reduce it. And we do all of that while adding benefits instead of taking benefits away. That's a that's a good recipe for a good health plan that will last. The members will like it. The plan will run well. Everybody will be satisfied. And some people on here may go, okay, yeah, not sure about that. We're not saying this is the only way to do it. There may be something else. We just haven't found it. This is the strategy that we see going forward because of things like the transparency law and virtual care and what's happening in the pharmacy world. Maybe you've got a different strategy. We'll just say this. The only strategy that we know generally fails is hope. Hope is not a strategy. So I don't know what you're doing with your clients today. Um, but if you're not doing this, we need to be doing something because hope is not a strategy. We hope this is something you'll consider for your clients. We think it makes sense. We think it works long term for clients. If it is something that you want to look at, we'd love to talk to you at 90 Degree Benefits. You can reach out to your local sales rep and we'll visit with you in greater detail. At 90 Degree Benefits, our mission is really simple. We're here to serve our customers through collaborative, courageous actions. When you look at our core values, customer first always is at the top of the list. We serve our customers, and we think this is a great plan design to serve our customers as we go forward. You can utilize Right Turn RX to help on your pharmacy and 90 Degree Benefits Care Connect for in-network care navigation to build this plan out for your clients and have something that'll win into the future. If there are any questions, I'm happy to stay on. You can also reach out to me or any of your sales reps at 90 Degree Benefits, and we'd be happy to talk you through how we can build this out in specific markets for specific clients. And with that, we thank you.